With the two categories we're talking about SGLT2 inhibitors and GLP-1 agonists. The SGLT2 inhibitors, basically, their mechanism is to trick the kidney into letting glucose spill out. So the way the kidney works is it's a filter. So it filters stuff out, and then sometimes it'll pull things back in that it didn't want to filter out. The way the kidney works, it doesn't just selectively filter. Sometimes it filters stuff out that it didn't want to filter, and so it just reuptakes those or reabsorbs that. The blood sugar, when it's too high, will filter through the glomerulus, the filter membrane of the million filters in each kidney. Further down the urinary collection tubules, we will reabsorb that glucose. SGLT2s stop that reabsorption process. So basically, you just pee out or you urinate out extra glucose. The mechanism for GLP-1s, GLP stands for GLP, glucagon-like protein, and glucagon is a satiety hormone. It helps us feel like, okay, I've had enough to eat. It stimulates that protein. It actually stimulates pancreatic insulin secretion. It mimics that hormone, so it decreases your appetite. And it actually, some of these drugs, the GLP-1s, are used for significant weight loss. And we'll talk about that a little bit later in the show content today. So what's the downsides of these drugs? Well, with the GLP-1s, because of their stimulation of pancreatic insulin production, you can actually get overstimulation of the pancreas. There is some risk for what we call MEA, multiple endocrine adenomatosis. Again, a technical term. Bottom line is some types of pancreatic tumors. And so that's what the risk is there. And it sounds very, very scary. You just put that together, though, and balance that against diabetes. There are times when these make sense. And in fact, as you look more and more deeply at these, and as you look at the science that we'll cover, the risks associated with diabetes, insulin resistance are much, much bigger than the downside risks of these two drug classes. What's the downside risk for SGLT2s? Well, because you're spilling glucose in your urine, then you have some risk associated with infection. You can get a fungus infection of your private parts. So again, SGLT2s, sodium glucose cotransporter inhibitors, they decrease renal glucose reabsorption. Some drug names: dapagliflozin, empagliflozin, canagliflozin. Now, the GLP-1s stand for glucagon-like proteins or peptides. Agonists, they stimulate pancreatic insulin secretion. Here's some examples of that: semaglutide, exenatide, dulaglutide, liraglutide. For the most part, injectable. There are a couple of them that are not injectable, pill form. Ozempic, one of those versions. Ozempic, by the way, it's a GLP-1 agonist which is used for weight loss.